Hello everybody. Our setup is called Public Health Sharing. Our team is me, Alma, a design thinker, Gaspar, a programmer, and Lily, a design thinker.
What is Lyme disease? So, my friend's mom got bitten by a tick, and because the symptoms of Lyme disease are so different, it's almost impossible to diagnose, and she thought that she had early onset Alzheimer's or dementia. But her daughter, my friend, hers is more of a brain swelling, and it affects her cognitive ability, and her immune system is very weak, and it also means that she can't read, and she doesn't think like us. Her brain's kind of foggy.
So what is scoliosis? I have a best friend who was diagnosed with scoliosis, and one of the possible treatments was to wear a corset during the night. She would tell me that the first week she was crying for 3 hours in bed because it hurt so much. So approximately 3 million teens in the US are diagnosed with scoliosis.
There are 329,000 new cases of Lyme disease every year in the US, and about 20% of patients continue experiencing symptoms after treatment.
So this is what our product would look like, and our product would help these children with these diseases not feel so lonely when they're diagnosed, and get in contact with other people that have the same disease to help them get through with their day-to-day lives. Here they would also be able to put in their mood and a certain event. When you're wearing a corset, you also need to log how many hours you're wearing it. So here you could log it manually, or later on I'll talk about a way that you can log it, that you don't need to log it at all actually. And this would just be a quick overview where you'd click on the day and it'd tell you the mood that you were in that day, and the events and the number of hours you've missed, for example, being in your corset that week or that month. Business model.
So, our key partners would be doctors, hospitals, and corset makers.
Our key activities would be the sensors. So these sensors, you'd put them in your corset, and it would sense when you have it on, and that data would be transferred to the website that we have, so that the child doesn't even need to go on and log it every day. Since the corset also presses on your bones to make sure that your scoliosis doesn't get worse, it would also be able to measure the heart rate, which would be additional data for hospitals.
Our key resources would be doctors, so mostly osteopaths, but also neurologists and psychologists, web developers, and lawyers, because kids' information is heavily protected and we want to respect their privacy.
Our value propositions would be the emotional support that the children would get by logging on to these group chats where they can share their feelings and how it is to live with these conditions.
Our consumer relationship would be professional intervention so that these kids could learn more about their diseases and how to treat them properly.
And our revenue would be by selling analyzed data that is, of course, anonymous to hospitals so that they can learn more about the disease and the kids and this population that it affects. Thank you for listening. Here's our prototype.
On a fait, pour l'instant, on a fait un peu une maquette du site. Maintenant, ça ressemble un peu à ça. Et le site il a plusieurs fonctions. Déjà, ça c'est l'accueil. Ici, on a la possibilité donc, de se créer un compte pour mettre son adresse, les conditions de santé, le pays. Dans ce cas-là, simplement le login ici. Dans le site, pour l'instant, il y a un calendrier. Ici, par exemple, pour les dates importantes et tout, pour ceux par exemple qui ont le syndrome, qui de temps en temps oublient certaines choses. On n'a encore rien pour le profil. Ici, c'est pour envoyer les symptômes que la personne a. Ça peut donner certains conseils, en fait. Et ici, on a fait une fonction où on a une intelligence artificielle que si on écrit quelque chose, par exemple en anglais, par exemple I'm very happy, ça va nous dire par exemple si c'est une émotion positive, négative ou neutre. Je vais vous montrer. Si ici j'écris I'm very Rapide. J'ai pas encore fait le bouton pour qu'on puisse voir le résultat. Donc pour l'instant, je suis obligé de le respecter. On va cliquer sur Submit. Ici, ça va apparaître. On va voir que c'est ici type positif. Donc c'est une émotion positive. Ici, si j'écris par exemple un feedback, par exemple, ici, il va nous donner le résultat que c'est une émotion négative, par exemple. Donc c'est tout pour l'instant.
This would be used so that we also get additional data on how the child is feeling on top of what I'm going to.
And also, because in Lyme disease, there are also mood swings, which is one of the symptoms. Well, if the mood swings happen at a specific time of month, you could receive a message saying, careful, you're prone to being sensitive at this time of month, for example.
Okay, amazing. Okay, right.
Wearable IoT